Jackie, a junior Black woman at the health department, is driving into work. Today is a great day because she's very excited about the new addition to her team who will be able to share responsibilities that she has been juggling for months alone. On her way in, she gets a phone call from her partner, telling her that the rent is being raised because of the gentrification happening in the area, and they may have to move from their home because they can no longer afford the rent. Despite this alarming news, she heads in, ready to meet and train her new teammate. As the day continues, she finds out that the salary of her new colleague, a white man with less experience and training, is 40% higher than hers. Immediately, she remembers a conversation earlier and her having to move her family. She also realizes she would not need to if her salary was comparable to her new counterpart. What happened in this scenario is an example of structural racism. Structural racism is defined as a totality of ways in which societies foster racial discrimination through mutually reinforcing and equitable systems, like housing, education, employment, earnings, benefits, credit, healthcare, criminal justice, and so on, that in turn reinforce discriminatory beliefs, values, and distribution of resources for racially marginalized people. In this example, Jackie is driving to work and hears from her partner that the direct impacts that they are experiencing due to gentrification in their neighborhood. Additionally, at work, she is experiencing wage discrimination. Making more money allows for increased ability to secure safe and thriving, stable housing in well-resourced neighborhoods. The research shows that there is significant wage disparity between men and women, and due to an intersectional form of oppression, Black women on average earn just 63 cents for every $1 earned by white, non-Hispanic men in 2020. Additionally, Black women are more likely to experience housing instability, a key social determinant of health, and displacement during gentrification due to many factors like affordability and discrimination. As Jackie's supervisor, how would you respond to her? After learning the news about the salary discrepancy, Jackie brings this to her manager's attention, and her manager immediately requests a racial and gender audit to assess disparities in salaries. After conducting the audit for all employees, the health department adjusts salaries accordingly for all impacted employees and requires all grantees of the public health department to do the same. On the way home, Jackie calls her partner and tells them that they will be able to stay in their apartment because of the equity review at work and her expected pay increase, which would be great for their family since they had been living there for years and are already tapped into the neighborhood's resources. This is anti-racism in action, actively thinking about how a policy or practice is creating inequities by racial and ethnic groups, and actively creating parity and utilizing institutional power, requiring all affiliates to ensure equity in their organizations as well. An action on behalf of her will have great impacts for many employees at the health department and in the community, and improve their ability to access necessary resources for their health and well-being that might have been previously outside of their budget.